Hello guys, once again welcome back. Want to go over Medicare Advantage programs with you. They're a little bit different than Medicare supplements. Actually, I guess you could say technically they're quite a bit different than Medicare supplements. What we want to go over is why they're out there, why they are called Advantage plans, and why you may be able to take advantage of them. I guess that's a lot of advantages. Anyway, real briefly, you have to be careful with Medicare Advantage program. They've gotten a bad name in the past because they were misused. You got a lot of, you need all the information to make a logical decision. And when someone doesn't give you that information, it leaves a bad taste in your mouth. Medicare Advantage programs, unlike supplement programs, are limited to certain areas. If you watch one of the previous videos of Medicare supplements, you'll notice I was telling you that you can go pretty much anywhere in the country and get care at different primary cares. Very few referrals, if any, are needed, but they do charge you a fee for that. Now, under a Medicare Advantage program, a little bit different. You've heard them called as replacement plans. You've heard all kinds of stuff out in the industry. Nothing takes away your Part A and Part B. Those are fixed in stone. They're not going away, period, no matter what you do, okay? The difference in when they say a replacement plan is because the administrators are different, the rules are different. Under a supplement program of Medicare Part A and Part B, when doctors sign up for that program, they still have to sign up for it. The rules are very liberal, very few regulations. They can run up a pretty good bill and ship it off to Medicare real easily. What happens under a Medicare Advantage program is that Medicare has said, or CMS has said, hey, these people are qualified to offer plans under Medicare Advantage. Under the Medicare Advantage program, instead of CMS, Medicare being responsible for all the administrative works of taking care of the client, that has been passed on to an insurance carrier, and they're responsible for it. So guess what? When doctors sign up under those plans, they are adhering to certain rules of the plan based on what the insurance carriers have set for it. Now, that may sound a whole lot real weird, but let's bring it back down home. Most people that are retiring right now, looking at Medicare, are coming off of some type of employer's plan. Guess what? That employer's plan was covered by a private insurance carrier. They made up the rules that you had to abide by for yourself and for the doctors when they were on that plan. For instance, Blue Cross Blue Shield. And guys, I'm just using that name. I could use Humana, Aetna, United Healthcare, and several others. But let's say that you are when you were at work, you went in under that employer's plan that they chose because it was probably less expensive for the employer, and they went to these companies. They brought them into you, and you got to choose what type coverage you wanted under that employer. But once you chose someone, you got into, you had most likely, in most cases, premiums you had to pay. They came out of your check. You had deductibles you had to pay. You had co-pays you had to pay. And you would probably have to go see certain doctors within a certain area. Now, there's things of HMOs, PPOs, and all that kind of stuff. Guys, that's just different sides of networks as well. HMO is very contained. When I say contained, it may be contained to the DFW area. It may be contained to the Houston area. It may be contained within New York. But it is contained. Some programs have more doctors in them than others. That's another thing that you have to be very careful about. If you're going into any of these plans, you need to find out what the doctor network is for your area. There's some that may only have 2 doctors in it. Guess what? You're going to be in trouble. You got to go see one of those 2 doctors. There are some that have thousands of doctors in them, and when you go start looking at the rankings of doctors and who's getting recognized as best doctors, best list, top 10, whatever, a lot of them are already part of those programs. The way I like to use that type of program is I like to find out exactly the doctors that the clients are already, Exactly what doctors you're already seeing. In most cases, in the Dallas area, I get that names list, a doctor list from my clients, and I match them up with a program, and all the doctors are already in the program. So for that client, nothing changes. They go from employer's program to a Medicare Advantage program, and they get to see the same doctors. The only difference is instead of pulling out their insurance card that they had at work, they'll be pulling out an insurance card that's being sent to them by Medicare Advantage program. That's really short answer of it. Now, under a Medicare Advantage program, you have HMOs, which is more contained than PPOs, and then you have a point of sales type program, POSs. All those acronyms, all that means is the size of accessibility to the networks. Usually, if you stay within an HMO, as in the Dallas-Fort Worth area, once again, thousands of doctors and locations. That's under many HMOs here in the Dallas area. And as long as you stay within that, the Medicare Advantage programs do not cost you anything extra out of your own pocket in most cases. If you go to a PPO, guess what? Larger network. You can start using people outside of the network. The carrier still pays for it. But because of that option of going to see more people, you can now end up with a monthly fee. If you go with a POS, same thing. Larger network, larger accessibility. Now you may come out with a higher fee. Now they're not all they don't all contain fees. It just you have to be very careful of where you live, the size of the network, and what you're trying to accomplish. Now, after all that said and done, why would you go with a Medicare Advantage program over a Medicare Supplement program? As I was just talking about, there's many a times you can get into these programs and it costs you no extra money. You still got to pay that $100 a month to Part B. Like I said, that never goes away, no matter what you do. But there's not an additional fee being charged by the different carriers. They are very good based on what they do in the employer's realm of managing care. What does that mean? They may tell a doctor, hey, listen, we don't want you to run 10 tests at one time when somebody comes in for a hangnail. That's kind of out there, guys, but that's you get the gist of it. They got different rules set aside that's a little bit more strict than what Medicare has out there. So it restricts the doctors what they can do. They are restricted also of what they can charge for. Insurance carriers they really frown on doctors charging you more than what they have already pre-negotiated with that doctor. That brings up another subject. When a doctor is part of a network, they have agreed to be charged a certain thing for certain services and agreed to also abide by the rules. When you get away from that and go into POSs and PPOs and all that kind of stuff, you can go to doctors that have not agreed to those fees and charges, which means you could be charged extra for that. So guys, just be careful what you're doing out there. Let me get back to this. Medicare Advantage plans, if you do not do, if you have one home, you're relatively stationary, you don't move around a lot, can be very good for you because it's going to be limited to the local area in which you live. I'm in Dallas-Fort Worth area. That means all counties, Dallas County, Tarrant County, and any county that touches those is within an HMO network. That's a lot of doctors. So if you're stationary and you don't travel and stay away from home 2-3 months at a time, if you're relatively healthy, you only go to the doctor once a month or less, man, a Medicare Advantage program can save you a lot of money because there are no additional monthly premiums outside of that $100 that we were talking about. In addition to, a lot of them also includes the prescription drug plan. I'm going to cut this video a little short. I'm not going to cut it short. I'm going to cut it off. I'm going to re-continue this in a video just below if you want to continue this conversation with me because we're coming up on the 10-minute mark and I'll make sure all these videos are less than 10 minutes long. So, hey, if you want to hear more, click on the videos just below and we'll continue this. Thanks a lot.